So the mammograms, again, like what is the age for the screenings? Like what is it now?
So routinely we say starting at 40, and then yearly. Now it can be sooner based on family history, but routine, I have no risk factors, run-of-the-mill lady 40, and then yearly after that.
And then with pap smears, what's that look like?
So starting at 21, and PAPs get a little confusing, right? Because it depends on if you're just doing pap smears alone or HPV testing with it. The recommendation depends on age. So it's a little different in that 21 to 30 age range versus 30 to 65 and where you do that. But I usually say starting at 21, going at least until 65, sometimes later, depending on what your history's been, and kind of at a 3 to 5-ish year interval, depending on the testing and the results that can be.
Didn't it used to be every year?
Yeah.
It did used to, before HPV testing, they did do it pretty much every year. And a lot of women, think, well, I'm not having babies anymore. Why would I need to go for a PAP? And those are the cases where things can get missed because we're not doing that routine screening. And so even if you don't think you need us anymore, just come in for that yearly visit so we can make sure you don't need that screening. Some women have had a hysterectomy. Their uterus and cervix are gone, but they had abnormal pap smears before. So they still need pap smears, right? So there's still indications for pap smears that maybe we don't think we need them anymore, but actually based on guidelines, they really are still indicated. So we don't want to miss anything like that.
And unfortunately, ovarian cancer screening, we've not made really a whole lot of progress with, So there is no real screening test for ovarian cancer other than doing an exam. And the number of times that you find things, on women on exam that had no idea, whether it's an ovarian mass or large fibroids or other things, those sorts of things, there is some benefit to still having the pelvic exam done.
And you would notice that with the pelvic exam. Okay. Wow, I didn't realize that.
That makes sense.